This is Eye on the Community, and I'm your host, Sean Anthony. Joining me up next is Dr. Ariana Hoet, who is the clinical director of On Our Sleeves and the pediatric psychologist at Nationwide Children's Hospital. Dr. Ariana, welcome to Eye on the Community. How are you?
Good. How are you?
I'm doing excellent. It's good to have you on. So let's talk about this operation On Our Sleeves.
Mhm.
From my understanding, you guys conducted a survey. What were some of the findings from your survey?
Yeah, so we surveyed a little bit over 2,000 parents and caregivers, and our findings showed that 93% of those parents and caregivers said, we know it's important to talk about children's mental health, but 59% said we need help starting that conversation. We don't know how to talk about children's mental health. And interestingly, we also asked if what their experiences were talking about mental health in the home growing up. And only 43% said we talked about mental health growing up. So it makes sense that we're hearing, yes, this is important, but I don't know how to get going, how to get started.
Tell us a little bit more about Operation Conversation.
Sure. So Operation Conversation is resources, strategies to get people going with having those conversations. So, kind of in response to that, ask for help of how do I get going? We have strategies to get the conversation going, strategies to keep the conversation going. So, once a child shares something, how do I respond in a way that helps the child feel good and happy for sharing and reinforce so that they come back later? And then we also have strategies of, well, what if I have some questions or what if I have advice to give? How do I do that in a way that the child will listen and again feel good about the interaction with the adult?
Absolutely. Why is it important for parents to start this conversation?
Well, it's really important. We are called on our sleeves because children don't wear their thoughts on their sleeves. And we know that the way we think is how what impacts how we feel. And so we have to start talking with children to figure out what's going through their mind, what experiences are they having, to understand how they're feeling. Mental health of children, unfortunately, has been showing concerning trends even before the pandemic. The 10 years before the pandemic, we were seeing an increase in sadness and hopelessness, thoughts of suicide. And then the pandemic made things even worse for those trends. And so it is really important we stop and check in with children every day about how they're feeling.
We may have some parents listening right now, Dr. Ariana, and wondering, how can I start this conversation? What are some tips for parents to start the conversation?
So, the tips we have for starting the conversation is picking a time in the day where you're going to make it a habit, a routine, where every day you're going to have this 10-minute check in. So, whether it's at the dinner table, on the drive home, at bedtime, that's when I like to do it at home, right when I'm tucking my little one in, and then just check in. We have conversation starters at onoursleeves.org that are free for downloading, that are just sample questions you can ask. What was the best part of your day? What made you proud today? When you're sad, what helps you feel happy? And just questions that parents can ask to get the conversation going. And then we also recommend modeling, talking about your emotions, sharing when you're having a tough day, and then what you do. Like, today was a stressful day for me, so I'm going to play a song and dance for a little bit to help myself feel better. And that way kids learn that it's normal to share and that emotions are okay.
That's great information. What would you say are some warning signs that your child may be struggling with their mental health? And if so, what steps should you take?
Sure. So we look out for changes in behavior and pattern. So, as kids grow up, their behavior obviously changes, their mood will change. So when it comes to mental health, we're looking at things that stick around. So let's say a child all of a sudden starts being irritable pretty frequently. So every day, almost every day for longer than 2 weeks at a time, or they're really sad, they're really nervous. We look for patterns in withdrawal and avoidance. They don't want to do things anymore. Things don't seem fun anymore. The activities they used to enjoy, they're not interested in. And so you start to see maybe less socializing, or school's not going as well, grades drop, or they start getting into trouble. So, again, if those patterns are almost every day for a long period of time, that's a sign that it's a little bit more than just normal child development.
Excellent. So, what other resources out there are available where parents can get more information?
So I say go to honorsleeves.org. We have a lot of information on how to promote mental health and wellness in children. The same way we talk about eating healthy and exercising, we want children to also learn what do they need to do to stay mentally fit and mentally healthy. And so that is all free at honorsleeves.org. And we also have an e-community. You can sign up and get one weekly email with a new strategy or new educational information right to your inbox.
She is the clinical director of On Our Sleeves and pediatric psychologist at Nationwide Children's Hospital, Dr. Ariana Hoet. Thank you so much for sharing this valuable information on our community.
Thanks for having me.
You take care.
You too.
Bye now.